Doctors reveal 7 warning signs the elderly show a year before death that you must know. Understanding these signs can help families and caregivers provide better care and prepare emotionally. It's important to recognize these subtle changes early to ensure comfort and support for our loved ones. If you find this valuable, please leave 1 subscribe, 1 comment, and 1 like for this video. Your support means a lot. Don't forget to share this video on various social media platforms to help others stay informed and compassionate towards the elderly in their lives. Lesson 1. Significant weight loss. Unexplained and rapid weight loss in elderly individuals is a critical warning sign that should never be ignored. When seniors lose a noticeable amount of weight without trying, meaning no changes in diet or exercise, it often indicates that their body is struggling with an underlying health issue. This kind of weight loss can be caused by a variety of serious conditions, including infections, cancer, thyroid problems, or gastrointestinal diseases. Additionally, it may signal that the body is not absorbing nutrients properly due to digestive issues. Weight loss in the elderly is especially concerning because it weakens the immune system, reduces muscle mass, and increases the risk of falls and fractures. It can also lead to greater frailty and make it harder for the body to recover from illness or injury. Sometimes, mental health issues like depression or dementia can contribute to poor appetite and unintentional weight loss. Family members and caregivers should pay close attention if an elderly loved one suddenly starts losing weight. Early detection and medical evaluation are crucial to identify the cause and begin appropriate treatment. Supporting proper nutrition and regular health checkups can help manage and potentially slow down the progression of weight loss, improving quality of life and overall health. Would you like a similar expansion for the other signs? Lesson 2. Decreased mobility and strength. Decreased mobility and loss of strength in elderly individuals are serious warning signs that should not be overlooked. When seniors begin to experience difficulty walking, frequent falls, or need more help with daily movement, it often indicates declining physical health and increasing frailty. These changes can result from muscle weakness, joint pain, neurological issues, or chronic diseases such as arthritis, Parkinson's, or stroke. Loss of strength and mobility not only limits independence, but also increases the risk of injury. Falls are a leading cause of serious injuries like fractures and head trauma among the elderly, and can lead to prolonged hospital stays and reduced quality of life. Furthermore, decreased movement can cause muscle atrophy and worsen overall health by reducing circulation, balance, and coordination. Dependence on others for basic activities, such as standing, walking, or climbing stairs, can also affect mental and emotional well-being, leading to feelings of frustration, helplessness, or depression. Early recognition of these signs is vital. Physical therapy, exercise programs tailored to seniors, and medical interventions can help slow mobility loss and improve strength. Encouraging regular movement and providing assistive devices when needed can greatly enhance safety and quality of life for elderly individuals. Want me to keep going with the others? Lesson 3. Chronic fatigue and weakness. Persistent tiredness and ongoing weakness are important warning signs in elderly individuals that often indicate the body is struggling. When fatigue becomes chronic, lasting weeks or months and worsening over time, it's usually more than just a result of aging or normal daily activities. This persistent exhaustion can signal underlying health problems such as heart disease, anemia, infections, diabetes, or chronic kidney disease. Chronic fatigue in seniors also affects their ability to carry out everyday tasks, leading to reduced physical activity and social isolation, which can further weaken muscles and overall health. When the body is constantly tired, it struggles to repair itself and maintain vital functions, increasing vulnerability to illness and injury. Moreover, fatigue and weakness may be linked to mental health issues like depression or anxiety, which are common but often overlooked in older adults. These psychological factors can worsen physical symptoms, creating a cycle that is difficult to break without proper care. It's important for family members and caregivers to notice when an elderly person's energy levels drop significantly and persist. Early medical evaluation can help diagnose the cause and provide treatments or lifestyle adjustments. Proper rest, balanced nutrition, and tailored exercise can also support improved energy and well-being. Would you like me to continue with the next sign? Lesson 4. Changes in mental state. Changes in an elderly person's mental state, such as confusion, memory loss, or increased periods of silence, are serious warning signs that can indicate cognitive decline or the progression of dementia. These symptoms often develop gradually and may be mistaken for normal aging, but they can signal underlying neurological conditions like Alzheimer's disease or other forms of dementia. Confusion can manifest as difficulty understanding conversations, getting lost in familiar places, or not recognizing close family members. Memory loss may affect short-term recall, making it hard for seniors to remember recent events or appointments. Increased silence or withdrawal from social interaction can be a response to frustration or fear caused by cognitive changes. These mental shifts not only impact the individual's quality of life, but also pose safety risks, such as forgetting to turn off appliances or wandering. Early detection and diagnosis are crucial to managing symptoms and planning appropriate care. Family members and caregivers should be vigilant in observing any sudden or gradual changes in mental state. Consulting healthcare professionals can lead to treatments that may slow progression and provide support strategies, helping maintain dignity and improving the overall well-being of the elderly individual. Ready for the next one? Lesson 5. Loss of appetite and difficulty eating. A reduced interest in food or difficulty swallowing are important warning signs that may indicate serious health problems in elderly individuals. Loss of appetite can stem from a variety of causes, including chronic illnesses like cancer, infections, depression, or side effects from medications. When seniors eat less, they risk malnutrition, which can weaken their immune system, decrease muscle strength, and slow down recovery from illness or injury. Difficulty swallowing, medically known as dysphagia, is another critical concern. It can result from neurological conditions such as stroke or Parkinson's disease, or from issues with the throat or esophagus. Trouble swallowing increases the risk of choking and aspiration pneumonia, a potentially life-threatening condition caused by food or liquids entering the lungs. These eating problems often lead to weight loss, dehydration, and overall decline in health. Additionally, they can affect the elderly person's mood and willingness to engage socially during meals. Caregivers and family members should watch for signs such as coughing during eating, refusal to eat, or prolonged meal times. Consulting healthcare professionals early can help diagnose the cause and provide treatments or dietary adjustments to ensure the individual receives adequate nutrition and maintains their strength. Want to keep going? Lesson 6. Increased hospitalizations or medical complications. Frequent hospital visits or a rise in medical complications are key warning signs that an elderly person's health is deteriorating. When seniors experience worsening chronic conditions like heart disease, diabetes, or lung problems, it often leads to repeated hospital admissions. These hospitalizations indicate that the body is struggling to manage ongoing illnesses and may be entering a more fragile state. Each hospitalization carries risks, such as infections, loss of muscle strength from bed rest, and confusion or delirium caused by changes in environment and medication. Multiple admissions also disrupt routines and reduce the elderly person's quality of life, increasing stress and vulnerability. Medical complications may include infections, pressure sores, medication side effects, or new health problems emerging alongside existing conditions. These complications can accelerate physical decline and make recovery more difficult. Recognizing this pattern early is essential for families and caregivers. It allows for better coordination of care, possibly shifting focus toward comfort and quality of life rather than aggressive treatments. Palliative care or hospice services may become appropriate to support both the elderly individual and their loved ones during this stage. Would you like the last one now? Lesson 7. Withdrawal from social activities. Withdrawal from social activities is a significant warning sign that an elderly person may be experiencing emotional or physical decline. When seniors lose interest in hobbies, avoid spending time with friends and family, or become increasingly isolated, it often reflects deeper underlying issues. This behavior can stem from depression, anxiety, or feelings of loneliness, which are common but frequently overlooked in older adults. Physical health problems, such as chronic pain, fatigue, or mobility challenges, may also limit a senior's ability or desire to participate in social engagements. Cognitive decline or sensory impairments, like hearing or vision loss, can contribute to frustration and withdrawal, making communication more difficult. Social isolation can accelerate both physical and mental decline, increasing risks for dementia, heart disease, and even mortality. It affects overall well-being by reducing emotional support, stimulation, and a sense of purpose. Family members and caregivers should be attentive to changes in social behavior, encouraging gentle participation in favorite activities, facilitating social connections, or seeking professional help can improve mood and quality of life. Addressing withdrawal early is vital to prevent deeper decline and to help seniors maintain meaningful relationships and engagement. Would you like me to help with anything else? Conclusion. Recognizing these 7 warning signs in the elderly can make a profound difference in their care and quality of life. Significant weight loss, decreased mobility, chronic fatigue, mental changes, loss of appetite, increased hospitalizations, and social withdrawal all signal that an elderly loved one may be facing serious health challenges. Early awareness allows families and caregivers to seek medical advice, provide compassionate support, and make informed decisions. Stay vigilant, show patience, and prioritize their comfort and dignity. Thank you for watching. Don't forget to subscribe, like, comment, and share this vital information to help others.